Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5. I'm your host, Dr. Stephanie Duger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. Welcome back to Prepared for Parenthood. I'm so excited today. We have Dr. Veronique Mead, a medical doctor with a master's degree in somatic psychotherapy. She holds specialty trainings in trauma as a somatic experiencing practitioner and as a pre and perinatal professional. Prior to this, she was a Dartmouth-affiliated assistant professor in family medicine and obstetrics. For the past 25 years, she has researched the scientific literature on how the effects of trauma influence risk for chronic illness. Veronique has published a new construct she has coined as Adverse Babyhood Experiences, or ABEs, to highlight 10 categories of adversity before a child's 3rd birthday that influence risk and provide opportunities for prevention and repair. Thank you so much for joining us today, Veronique.
Thanks so much for having me, Stephanie. It's good to be here.
So your work is so fascinating for me. Can you explain what adverse babyhood experiences, or ABEs, are and what the 10 listed actually are?
Yeah, so my population through my blog, Chronic Illness Trauma Studies, is primarily for adults with chronic illness. And I've been researching the role of trauma as a risk factor for chronic illness for the past 25 years. I'd never thought about this as a doctor, and it was only when I retrained in somatic psychology that I started understanding and learning about trauma in the first place, and then got curious if trauma is a risk factor for these more psychologically oriented symptoms as we understand them, like PTSD. I had an aha one day, could it be a risk factor for chronic illness? And I started looking into the medical literature for that. I first heard about adversity in babyhood as a risk factor for asthma. And this was work with a psychologist, Tony Madrid in California, who stumbled on this. He essentially discovered that kids with asthma have had 3 times more experiences of adversity in the pre and perinatal time frame than the same age kids that don't have asthma. And what he discovered was that if he helped the mother work through some of these events in the pre and perinatal, so maybe there was a lack of support, and I'll share the 10 ABEs in a moment, or there was a lack of connection or a bonding disruption, and we can get more into that. There are all kinds of events that can actually interfere, make a mom feel much more vulnerable, less safe, that it can interfere with that natural, innate impulse to bond. And so what he ended up doing was helping the mother repair these traumas, and the child's asthma went away. So that got me really curious. And over the years, I learned more about his work and the pediatricians whose work had influenced him. And I built this on the 10 adverse childhood experiences that people are more familiar with, the ACEs. Those are 10 specific types of trauma before your 18th birthday. But there's a whole other body of literature about the enormity of what's happening developmentally before our 3rd birthdays, and large bodies of research. So the 10 ABEs look at 5 events pretty much for mom and 5 for baby. And those events for the mother are her own history of stress or trauma or loss, lack of support or loss of support, especially during pregnancy and in those early years, and physical or emotional stress that could be being sick during pregnancy, for example, or depression or postpartum depression, and complications, which are pretty common. And a complication could include a cesarean, even a routine cesarean, if there are events there that just interfere with the normal flow of bonding. And then there's events for the baby that also influence bonding, in particular And so there can be complications for the baby, like being in an incubator, having jaundice, needing treatment. And separation of any kind is its own separate category. That's a huge thing that the research found is a risk factor for bonding disruptions, separation between mom and baby, parents and babies, caregivers and babies, especially in the first hours and days. And then birth weight is an indication. So if birth weight is 7 pounds or is under 7 pounds, that can be an indicator of prenatal stress. So that in there, as well as babies that weigh 10 pounds or more, sometimes that's an indication of exposure to prediabetes or high blood sugar in the womb or a lineage where the insulin resistance pattern's running. And then not being able to breastfeed, having difficulty breastfeeding, not having breastfeed, that's a separate category as well, because it can be an indication of bonding disruptions. And then number 10 is a whole slew of indications that I'd love to hear from your end with the work that you do, because my listeners as adults with chronic illness, these indicators are, I think, what bring parents with young babies and kids to you. And there would give people in my group a sense of what might have happened. Things like colic, if they were a baby that didn't sleep well or didn't gain weight well or cried a lot.
So again, it's so fascinating. I'm thinking about how frequently these ABEs actually happen. I can't speak for around the world, but in particular in the US, so many of these pieces happen quite frequently. And from your research, it sounds like a lot of these issues can be navigated through different therapies to help increase bonding and attachment, decrease things like colic, obviously help the first parent with postpartum issues or even perinatal mood disorders. But if they are not seen early on, they then develop into potentially chronic illness factors. Is that correct?
Ultimately, I think what we see in babies that are symptoms or what parents experience that, like you're saying, are so common. So, inductions can be a challenge sometimes, C-sections, anything that is an assistance for birth, or if there's a need for a medication treatment, but also preeclampsia if moms are sick, or if the partner leaves or a grandparent of the baby in the womb dies. That's a big event for the parents. And these are all really common. And if we can have an awareness that even though these are common, it doesn't mean that they have no impact, then these early symptoms, these indicators, can serve as opportunities for prevention and repair. And in Tony Madrid's work with the kids with asthma, this working with the mother to heal asthma in the child, he's found it to be effective for kids up to age 9. And after that, it's harder. And his thought, and I would agree, is that it's probably because by that point, there may be more events happening in the child's own life that make it harder to repair. But yes, this is all about opportunities for prevention, opportunities for repair, and that these are just indications of the nervous system showing signs of some dysregulation. So it could even be things like not being able to hold body temperature really well or heart rate really well. And we know from our perinatal work that if you hold a baby really close, the mature adult nervous system actually helps regulate the baby's immature nervous system. And this is a huge component of development that I never learned about in my medical training. And I think it's probably still very much missing in a lot of medical and obstetric training in particular. I was trained as a family doctor who did obstetrics. I was not an obstetrician with the extra years of specialty training, but I'd never heard of any of this before. And I think this is also where, if you're an adult with a chronic illness, there are still ways of working, even as an adult, with events that happen in that pre and perinatal time frame. And so there's a lot of different opportunities along the way. And I think that's the beauty of this for both your listeners and mine as well.
What strikes me, Veronique, is how all of these seem to be related to excessive stress on some level. And we know that stress can be helpful in a system. We need a little bit of stress to grow in certain areas, but too much stress and for a baby, too much stress compared to what an adult might experience as too much stress are pretty different, right? Just like a baby's experience of time is much slower, it's much more attached to the birth parent, it's moving at a different pace. And so my imagination is their experience of stress would be much higher because they're tucked into a very tiny body. And so a birth intervention or separation after birth is going to feel much more stressful for a baby than it might for full grown adults in the same situation. Although I would say the birth parent experiences excessive stress when their baby is separated as well. And the clients who tend to seek me out are people who, like you said, are experiencing some of those higher stress experiences of I'm not sleeping, my child has colic, there are challenges between my partner and I post birth because we weren't ready for this. We didn't really know what we were getting into, things like that. And often there's feeding challenges, breastfeeding or bottle feeding challenges, as well as things that develop a little later in toddlerhood and in preschool age. And so just thinking about the impact of stress and the training that medical doctors might receive around the impacts of stress. What was your experience in terms of stress related connections around illness?
I think there's still a big awareness in medicine that stress is a risk factor for a lot of things. And what we're missing in the medical model is what I learned when I retrained as a somatic therapist and a trauma therapist, where we're actually specifically looking into this as its own specialty. And what I've come to see is that there's a difference in how we understand stress versus trauma. And first, just to speak to what you were saying earlier, babies and parents and mothers who are pregnant in particular are more vulnerable, and that makes them more sensitive to stress. And it's really, I think, about an imbalance in the amount of support compared to the amount of stressors. And I think that's where the risk is. It's not that prenatal stress needs to be avoided at all costs because it's so common. And it's not about blaming parents or moms, but really, how do we provide enough support? That said, going back to there's a difference between stress and trauma. And the way I think of it is that stress is something that asks your system to adapt. So if a baby's separated by a few inches and the baby gets cold and you wrap it up and you put it on your chest and it gets warm again, it's just gone from stress to an adaptation that resolved the stress just by doing something. And that the baby's stress response, maybe their heart rate went down or up, or their temperature went down. That would be a stress response. It would be a change in the regulation of the system. And then when the baby comes back to enough support or proximity or warmth, the body shifts back into regulation. A stress response comes and goes. And when you change and adapt and meet the needs, the stress response goes away. Trauma is different. Trauma is an experience that is sufficiently stressful that it actually causes enough overwhelm that a nervous system and body goes into some degree of freeze, so that the response, say, of a baby to have a fight flight response, since they're so helpless and so dependent, it doesn't take as much for a baby to maybe have an experience that's overwhelming, such as maybe being separated and put in the nursery for 2 hours or 8 hours right after birth. That might be something that would be so overwhelming that the baby's going to sleep through the whole thing. And it's not just a normal, natural sleep, but it might actually be a freeze response in the nervous system. And what an experience this traumatic does that's different from stress is that coming out of freeze requires something different than just the comfort or just the warm sweater. In the wild, animals will actually discharge a certain amount of energy. It might be shaking or trembling. It could be crying. And when that happens, the nervous system gets the message that it's over, and then the system can come back down into normal regulation. And what happens for us as humans, not in the wild, with all that can happen during events in the pre and perinatal time frame or early on, is that there may not be enough time, there may not be enough support. And so at some level, there's a pathway that's associated with a freeze shutdown response that can get strengthened if more adverse events happen. So not everyone who's born C-section develops a chronic illness, and not everyone with a chronic illness was born cesarean. And I'm using cesareans because they are so common, and the rates here in the US, for example, are so high. It's not necessarily the event, it's how it's experienced. So if the mother and parents have enough support, and if everything goes well, and if there's bonding, those may all negate or help the nervous system catch up and integrate this and move on. And it's often when there are a number of things that happen in a row or events that happen again later in childhood that then lead this pathway, this freeze response that got stimulated with whatever survival pathway was interrupted. That appears to be what can lead to, in the long run, chronic illnesses. The chronic illnesses are driven by survival responses that didn't get to shut off.
So you mentioned asthma as one of those chronic illnesses. What are some other things that might show up?
In childhood, one of the more common autoimmune diseases is type 1 diabetes. And it's the disease that I've found where the most research has been done if we're looking at chronic illnesses specifically. Just as one example, they did a 14-year prospective study starting at birth with 10,000 babies in Sweden. And what they found when they checked at 1 year of age for antibodies, which can develop for many years before the onset of chronic illness, was that the 1-year-olds that had antibodies had had 3 times more experiences of either their mother experiencing divorce and or domestic violence. And those are 2 ACEs. Those are in the adverse childhood experiences. And we've actually learned that having 2 ACEs greatly increases the chances of a chronic disease later on in life or an autoimmune disease. And not everyone's going to develop this because there can be so much support. But at 2.5 years, kids that had antibodies had also had 3 times more adverse events compared to the kids who did not. And then the same thing at 14 years of age, the children who developed type 1 had had 3 times more adverse experiences. So that's an example of one chronic illness, and we see this in others. It's harder to study in adults because so much happens in between. But in childhood, the things that you mentioned earlier. So it could be colic, it could be nightmares that children seem to be having or toddlers, it could be not gaining weight, and it could also be looking for indications of bonding disruptions, such as these 2 pediatricians, Klaus and Kennel, found in the 70s when we started having more hospital births. And what they found is that this routine separation of putting the babies in the nursery to help the moms rest and also to help reduce infections. We were doing this thinking this would be really helpful. But what they were noticing was that if the moms didn't get especially a few hours of contact right off the bat, their bonding was different. This was not conscious, but they talked less to their babies, they gazed less, they snuggled and held them less. And so in a pediatrician's office, this could be something to look for, not for blame, but as an indicator that something happened, something interrupted that bond. And then it would be, what kind of work do you do? I think my listeners from my audience with chronic illness would be really curious about what kind of things do you do that could be preventive or repairing?
Yeah. So, in terms of repair, which is mostly those are the folks that I see, they come in after the problem has developed. I focus a lot on attachment and bonding. And so there's a lot of energy placed towards connection between the birth parent or birth parents and the baby or child. Sometimes there's involvement of play therapy for the child if they're a little bit older, helping themselves move through a tunnel, say if the parent had a cesarean birth, and processing the birth trauma or the separation trauma. A lot of it's around giving voice to things that we often don't share, either because we're afraid that the child is too young and won't understand or will be scared by the experience. But as you know from pre and perinatal work, children already know, right? They had the same experience, and bringing words to the experience for them helps them process it. And so we do it in a very age appropriate way. And then there's also a lot of bringing in support for the birth parents as well, or adoptive parents. And that experience of having enough support is so critical. And so I always try to help parents find groups to be part of where other people have just had babies or have little ones that they've adopted. And to have that support of other people going through the same experience at the same time is an experience that I can't provide as a therapist because my children are older. And so they need people to talk to about all of the things that are happening and to normalize all of the pieces that are happening and to bring light to those things that, hey, this actually is out of the range of what we might consider healthy and normal. And you might want to get extra support for that. So those are the kinds of things that I tend to focus on. And then in terms of prevention, which I unfortunately do less of because fewer people come for that. It's a lot about having deep discussions with your partner. If you have a partner that you're having a child with, of how are we going to navigate all these pieces of becoming parents together? And how are we going to navigate the stresses that inevitably come with bringing a child into the world and raising a child together? And so, again, there's a lot of bringing voice to these things that we may just have assumptions about. There's not a lot of training in how to be a parent. I would say there's very little training. And especially in the United States, a lot of people are growing up in their own little homes. They're separated. There's no village that's happening for a lot of people. And so they're not seeing a lot of babies until they have their own. And they don't see all the challenges. They're not getting extra support from generations before them necessarily. That makes it more challenging.
In a way, it highlights how our culture has a lot of disconnection and how much wisdom we've lost, not incorporated. In medicine, we've gone so cognitive and linear. We kind of treat a lot of medical things like you would fixing your car with the mechanic. But what you named, naming things and connection, the connection piece, and we talk about this a lot with adults, is this social nervous system piece. We think about it as part of our self care and how we actually orient to incorporating ourselves in the equation with chronic illness because it's gotten lost. Somewhere that initial freeze that got perpetuated with additional events instead of resolving can lead to a lot of relative disconnection that we don't even know we have. Disconnection from aspects of ourselves in our physiology. It's not a conscious thing. And so the support piece is actually huge because, as you named it, just gently teasing it apart and naming these pieces can be huge. And I've found also in all ages, naming things and why, and providing a context for why is it that this baby might be hard to soothe or crying more. This could be an indication of dysregulation, and it could even be an indication of the parent being dysregulated and that the unit has been impacted and that the unit needs more support, I think of this as prevention. Even though you're seeing folks with symptoms, I think of that work as being prevention for sort of more intensity of symptoms down the line that could be anxiety or depression as a teenager or an adult, or a chronic illness or chronic pain, kind of chronic health conditions later on. So even if they're early symptoms, I still think of the work you do as being preventative and or repairing. And parents often know this, right? They know something isn't quite right and they go to their medical professionals. And we are so used to seeing all this stuff as normal, and we don't have that really deep context that we get from the trauma research. And so I think this is one of my goals for my next decade. I'm just celebrating 10 years of blogging this year. And these next 10 years, I would really like to start to reach a little bit more out into the medical professionals. Because if we know this is a medical professional, then we can send people to people like you, or even just to support groups where they're providing this kind of education. And we can provide education as well.
So I want to loop back to the piece that you brought up about the study in Sweden about the children who developed type 1 diabetes. Do you know if early intervention helped any of those children not have it develop into a lifelong issue? Is that even possible?
I think it's possible, and I don't think they know about the kind of work that you do. Tony Madrid has been trying to set up a large study in a research university-based center for 30 years, and it hasn't happened. And so there's this divide still because of a lack of information. The information about trauma has not crossed out of the psychology world into the medical world. And there are a number of large thousands of kids being followed prospectively around the world in type 1 diabetes. I think partly because they have learned so much about the antibodies, for example. And years ago, one of the researchers was saying how they didn't have anything to offer. They don't understand enough to know what they could offer the parents as an opportunity for prevention. And so part of the reason I blog is to share the information with folks like parents of young kids so that people don't have to wait for medicine to get this information into the trenches of clinical care. I think there's enough research and enough evidence and enough small studies showing that if you help the parent connect and repair any bonding disruptions, it has a huge impact. You're probably familiar with this from APA, the Association for Pre and Perinatal Psychology and Health, for those of you who aren't familiar with APA, but the prenatal bonding BA, this is work out of Europe of helping a mother connect with her baby during the prenatal time period. And with that support, the outcomes that they have in some of their published research with what are now 10,000 babies of their own that they've tracked for these years, that it's much fewer interventions at birth are needed, much higher rates of breastfeeding, much decreased rates of premature birth, which is another factor that's associated with risk for chronic health conditions later in life. So I think we have the research, and I have a dream goal to someday be involved in a research study that would incorporate this pre and perinatal trauma work as a prevention, and to see, does it prevent or help repair or reverse antibodies? Because we know they can reverse.
That would be so interesting.
It would.
Can you share the kinds of work that you do in terms of preventing ABEs for chronic illness?
With my population of working with adults with chronic illness, I did psychotherapy work with adults before, and I would bring in the pre and perinatal training. And a lot of it has to do again with connection. And it's the connection that adults with chronic illness didn't get, the missing ACEs, as I think of ABEs and other ACEs that aren't just the 10 ACEs, and start with connection to yourself. And it includes beginning to notice and look for triggers. And what I've noticed with my own chronic illness, I've had chronic fatigue for 25 years, and it's much improved with all this trauma work. What I've noticed is that most of my triggers seem to be developmental trauma related. So it may be negative beliefs, harsh self-judgment. We see this in a study on my blog. People did the 10 ACEs, and the highest ACEs they have are for emotional abuse and emotional neglect, which is the developmental piece that I think links at least in part to bonding disruptions. And so the more we can become aware of triggers. So if you have a flare up with a chronic illness symptom, so for me, if I have a big drop in my energy levels and I have a big spike in fatigue, when that flare up happens, I've learned to get very curious with myself and also when I was working with clients of what happened before in the minutes or hours or days before that flare up. And that starts to open up the naming, like what you were talking about, and the getting curious about what might link to past events that are still showing up in this survival pathway today. Tony Madrid, in his work with asthmatic kids and moms, uses EMDR, eye movement desensitization and reprocessing. He also uses hypnosis. I'm a somatic experiencing practitioner. So there are actually a lot of different modalities that work specifically with trauma and trauma in the body, which means that you're tracking sensations and imagery and impulses. You're not just trying to talk your way through it, especially as an adult when a lot of these things are not in our conscious awareness.
We've been speaking today with Veronique Mead. She is trained as a medical doctor and also has her master's in somatic psychotherapy, as well as trainings in trauma and pre and perinatal psychology. Thank you so much for being with us today, Veronique. And can you share how people can find out more about you and your work and find your blog?
Yeah, my blog is called chronicillnesstraumastudies.com. And in the menu, looking at different types of trauma, you can drop down and you'll see a link to ABEs and different resources on ABEs. And one of the resources is an ABE fact sheet. There's one page of the literature specifically linking to the research on ABEs and chronic diseases of different kinds. And it's also helpful for parents. There are books as references and resources for parents of young children and also for adults with chronic illness. And I invite you to come take a look.
Thank you so much for being with us today, Veronique.
Thanks so much for having me, Stephanie. Good to be
Take
with you.
care. Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.